Hello friends, welcome to Creative Medicine. In this lecture, we will learn about antihypertensives with positive Coombs test is hydralazine because this can cause hemolytic anemia. So because it causes hemolytic anemia has a side effect, it is Coombs positive. Drug of choice for digitalis-induced vascular arrhythmias is digitalis-induced vascular arrhythmias. Drug of choice is IV lignocaine. Drug of choice for pregnancy-induced hypertension is methyl-dopa. Centrally acting sympatholytic agent is clonidine. All of the following are vasodilators except methyl-dopa is sympatholytic, whereas nitroprusside, hydralazine and diazoxide are vasodilators. Treatment of hypertension with diabetes mellitus is by ACE inhibitors is a better treatment. Antihypertensive causing sedation is clonidine. Which of the following is a Rho kinase inhibitors? Fasudil is a Rho kinase inhibitors. Okay, what are the uses of Fasudil? Fasudil is found to be effective in hypertension, pulmonary hypertension, coronary artery disease, diabetic cardiomyopathy, vascular angina, ischemic stroke, heart failure, and erectile dysfunction in animal models. All of the following can worsen angina except dipyridamole, thyroxine, and sumatriptan can worsen angina. How? Sumatriptan causes vasoconstriction, so thus worsens angina, whereas thyroxine is a thyroid hormone, so it causes tachycardia. Because of tachycardia, it will precipitate angina. Then dipyridamole results in coronary steal phenomenon. So because of the coronary steal phenomenon which is caused by dipyridamole, it can cause angina. Then thank you and thank you for watching.